Are you feeling a nagging ache in the back of your arm? Maybe a burning sensation each time you try to reach for something or push yourself up from a chair? Triceps pain can sneak up on you, starting off as a minor nuisance and growing into a serious problem. But why does it happen, and what can you do about it? Let's start by understanding the triceps muscle itself. This muscle, located at the back of your upper arm, has one big job: it straightens your elbow. So whether you're lifting weights, throwing a ball, or just pushing yourself off the couch, you're using your triceps. But this muscle also carries a risk of overuse and injury, especially if you're an athlete or regularly lifting heavy things. The common culprit, triceps tendonitis. Triceps tendonitis is the #1 reason for triceps pain. This condition usually happens when we push our muscles too hard, too often. Picture this: each time you extend your arm, a little bit of stress builds up in your triceps tendon. Over time, this stress can lead to tiny tears in the tendon, causing it to become inflamed. In many cases, triceps tendonitis affects people who perform repetitive motions in sports, like throwing a ball. It's most common in people between the ages of 30 and 40. If you're suffering from triceps tendonitis, you might notice pain at the back of your elbow that gets worse when you extend your arm. Stiffness or swelling in the area. While triceps tendonitis is the most frequent source of triceps pain, it's not the only one. There are other, more serious conditions that can affect the triceps, such as triceps tears and snapping triceps syndrome. When things tear, triceps tears a tear in your triceps is a more dramatic injury. Unlike tendonitis, which builds up over time, triceps tears usually happen all at once, during a fall, while trying to push something that's way too heavy, or from a sudden impact. Triceps tears can be partial, meaning some of the tendon fibers are torn, or full, where the tendon completely detaches from the bone. Symptoms of a triceps tear can include severe pain that comes on suddenly, swelling, bruising, and sometimes a blood-filled bruise known as a hematoma. Reduced ability to extend your arm and even changes in the shape of your triceps, especially with a complete tear. Full tears often require surgical intervention, while partial tears may heal with rest, ice, and time. Still, either type of tear can have a lasting impact on your arm strength and mobility if left untreated. The strange case of snapping triceps syndrome. Have you ever felt a strange snapping or popping in your triceps? This could be due to a rare condition called snapping triceps syndrome. It usually happens in younger people, typically around the age of 32, and involves the triceps muscle snapping to one or both sides when the arm is flexed. This snapping sensation can lead to pain, numbness, or tingling that radiates up the arm. If you're experiencing symptoms of snapping triceps syndrome, it's a good idea to see a doctor. They can help determine if you need treatment or if the condition can be managed with physical therapy and exercise. Understanding the bigger picture, it's clear that triceps pain can arise from a range of issues, from minor tendonitis to serious tears. But how can you tell what's going on, and when should you see a doctor? A doctor will usually start by asking you about your symptoms, recent activities, and any injuries. They'll likely examine your arm and might even order imaging tests like an MRI. However, even with these steps, triceps injuries can sometimes be tricky to diagnose. A 2015 review found that triceps tears are often overlooked, especially when they occur with other injuries like fractures. This makes it crucial to seek a thorough evaluation if you're dealing with persistent pain. How to treat triceps pain. The treatment for triceps pain depends on what's causing it. For triceps tendonitis, many people find relief with home remedies and conservative treatments. Rest. Give your triceps a break. Avoid any activities that make the pain worse. Ice. Applying ice packs to the affected area can reduce swelling and help numb the pain. Supportive devices. A sling or brace can provide extra support and help the triceps heal. NSAIDs, over-the-counter anti-inflammatory drugs, can help manage pain and swelling. If you're dealing with a partial tear, you may also benefit from physical therapy to strengthen and stabilize your arm. However, for more severe cases, or if a tear covers more than 75% of the tendon, surgery might be recommended. Surgical procedures can reattach torn tendons to bones and repair damage, often using stitches or anchors to keep everything in place. For those who undergo surgery, physical therapy afterward is essential to help restore strength and flexibility. Your doctor can help develop a treatment plan that suits your specific needs. Preventing triceps pain before it starts. Whether you're an athlete or just someone who uses their arms regularly, you can take steps to protect your triceps. Warming up with gentle stretches before physical activity can help loosen the triceps and prepare them for movement. Take breaks, don't push through the pain. Taking breaks and varying your activities can give your triceps a chance to recover. Get training. If you're new to a sport or exercise, work with a trainer to learn the correct techniques. Listen to your body. If your triceps feel tired or sore, give them a rest. Overexercising can lead to strain and injury. When to seek medical help. There are times when you should absolutely see a doctor for triceps pain. You should seek medical attention if the pain lasts longer than a few weeks, the pain is severe or impacts your daily activities, you notice other symptoms like swelling, limited movement, or a hematoma. Ignoring triceps pain can lead to further damage and might require more extensive treatments down the line. A healthcare provider can evaluate your symptoms, confirm the diagnosis, and guide you through the best treatment options. Facts on triceps muscle pain. Let's wrap up by answering a few common questions about triceps pain. Q. How can I relieve sore triceps? A. You can relieve sore triceps by resting, applying ice, using a supportive sling, and taking NSAIDs to reduce inflammation. Q. What does a strained triceps feel like? A. A strained triceps often feels sore and might be swollen, with symptoms like muscle spasms or cramping. Q. What does triceps tendonitis feel like? A. Triceps tendonitis generally causes pain, stiffness, and tenderness. The pain often gets worse when you extend your arm. In conclusion, triceps pain can be a real obstacle in daily life, but understanding the causes and treatment options can help you take control. Whether it's triceps tendonitis, a tear, or snapping triceps syndrome, knowing what's happening in your body is the first step to recovery. Listen to your body, seek help when you need it, and take preventive steps to keep your triceps healthy and strong. Remember, with the right approach, you can manage triceps pain and get back to doing the things you love.